As for your other question, truth is I didn't feel a great deal of political pressure as we analyzed the health legislation. We felt a tremendous amount of time pressure, and we were very careful to resist that in the sense that we did not rush out numbers that we were not satisfied with, and we were often being pushed to move more rapidly. And we worked very, very hard, but we insisted that we would do the analysis in a way that we thought was right and that we could stand behind, and we did. There were many people who were hoping for different outcomes of our analysis. There were people who thought that our analysis wasn't right. We received criticisms that the cost of the insurance expansions in the legislation would be more expensive than we expected. We also received criticisms that the savings through reforms in Medicare in the legislation would be much larger than we expected. We think on both those issues and many, many others that our estimates were in the middle of the distribution of possible outcomes. It's a very uncertain business, and we said over and over and over again that people should not put too much stock in the point estimate, the precise number we wrote down, because we could never be that sure given the nature of the changes that were being considered. But we think we were in the middle of the distribution of possibilities. And I think one important point to emphasize is that what we produced an estimate of was the legislation as written. There's another whole set of concerns that the legislation won't actually be implemented over time in the way that it's written down. People who think that Congress will make changes in those policies. And we've said ourselves in the cost estimates that we produced that a number of the changes in the legislation would be very difficult to sustain over a long period of time, and we weren't sure it was possible to sustain them. That's a kind of different issue because it is our responsibility to estimate the effects of the legislation as written down, and we can and should and did raise concerns about whether that legislation was sustainable in all of those ways. But it's our job to estimate the effects as the legislation is written down. And people who think that legislation will be changed later, well, if that happens, those proposals will then be estimated by the Congressional Budget Office in terms of their budgetary effects and their effects on health insurance coverage and other things.